Hello, ladies and gentlemen, and welcome to FWell Special. My name is Dennis Jai, and we are broadcasting from Atlanta, Georgia. In commemoration of Diabetes Awareness Month, we're bringing you diabetes awareness today. My guest and co-presenter is Mrs. Abby Tyler. She is the health contributor of FOL. This program is brought to you in conjunction with Abby Tyler Healthy Living. Abby, welcome to Focus on Liberia.
Thank you. Thanks for having me.
Okay, this month, November, as you said, is diabetes awareness. And so we are here to talk about diabetes. Once again, I want to welcome you to the show. And I want to thank Abby Tyler Healthy Living for this collaboration as we go ahead and talk about diabetes awareness. How significant is this month when it comes to diabetes?
Well, every day is actually diabetes awareness, but we usually take this month where the CDC and people in charge take this month to really hone in all the information that people need to see, because diabetes is a very it's like the expensive person disease, but it's very prevalent in every community, especially in the minority communities, and it starts overwhelming. So it's important that we took the time to take this month apart to really hone in all the information to everybody that needs it, that needs to hear it, because it affects the young, it affects the old, it affects every race, and it's heavy socioeconomic toll on the community as well. So thought to bring this to everybody's attention. And I take care of people with diabetes all the time, and some people don't know anything about it, and until they hear about it, and people need to know the proper information in order to save their lives or the lives of someone they love.
Thank you so much, ladies and gentlemen. This is Focus on Liberia. This is Diabetes Awareness Month, and we are having diabetes awareness. My guest and co-presenter is Abby Tyler. Abby, before we even go further, talk about a little bit about yourself and why is it that it's always good to tell people who you are so that they know why is it that you are qualified to speak to this subject matter.
Okay. I've been on a couple of times before, but for those of you who don't know me, my name is Abby Tyler, formerly Abigail Tyler. I was a nurse, a cardiac nurse for 20 years. I worked in a hospital. Spent 2 years in long-term care. I did some agency nursing. I am a graduate of Drexel University. I now work as a family nurse practitioner in a private practice in Philadelphia, been taking care of thousands of people over the years. And of course, especially this page and the forum, the group, and everything also is geared mainly to Liberians or Africans, and for more culturally relevant information, but it's for everybody. So I've been doing this. That's why I did the group, and now I'm doing the page so I can reach a wider audience. But I can say, yeah, I've been around the block of, a while now, and I think I'm okay to teach this. And at the same time, I also have it in my family too. I have diabetes in my family, so it's not something that I'm just presenting as a clinician. I also something that is in my family, and also have to watch out for myself. So I feel it's important to bring that to everybody's attention.
Thank you. And I too have diabetes in my family. A family member has diabetes, so this disease is very prevalent among us here, and that's why it's important. And so, if you have a family member or if you know someone with diabetes, and as we will learn later on, a lot of us at risk. So everybody needs this information. So invite a friend and let's talk about diabetes. I
Make sure
mean,
you
what is
introduce it.
diabetes? What is this all about?
Okay, before I start, I always have to give my disclaimer. What I'm bringing here to you today is for informational purposes only. I prefer that you take this information and take it to your doctor, your provider, nurse practitioner, PA, and say, okay, this is what I heard. I just need to ask some more information about it. So it is not intended to diagnose, treat, or so do not change any in your treatment until you speak to your doctors about it. So I'm bringing all this information is directly from my practice, from the American Diabetic Association, the CDC, United States Preventative Task Force, American Heart Association also. Okay, so what is diabetes? I'm going to give the scientific definition, and I'm going to break it down. So diabetes, excuse me, let me put my glasses on. What is diabetes? Diabetes is a syndrome of disordered carbohydrates, fats, and protein metabolism resulting in hyperglycemia that is caused by deficit in insulin secretion, insulin action, or both. So basically, to make it clear, when we eat our food, you take the food, you eat it, and everything it goes into your body. All right, but it breaks down into glucose in order for it to go into the cells for your body to use in order for everything else for your body to work perfectly. Well, your pancreas, which is the organ on your left side of your body, the computer is different. It's on your left side of your body. It secretes the insulin. Okay, so it secretes the insulin and it breaks it down, and then that carries it to the body, goes into cells, and it breaks it down, and your body functions the way it's supposed to function. And in addition to like making sure your medications, if you're taking any medication and all that, what happens is diabetes. When you have diabetes, the beta cells that comes from the pancreas, depending on in type 1 diabetes, we'll go into details in later. Your body doesn't make enough of that. It doesn't make enough insulin. So every time your body, when that glucose is in your body, it builds up, it builds up, it builds up, and there's no insulin there to break it down in order for it to go into your blood cells and all that. The glucose fills up into your body, and then resulting over time, it result into different complications that we will discuss later. But basically, meaning that your body, you eat, body breaks the food down to glucose, insulin needs to come over, take care of it, and break into the blood cells for your body to work. Where there's no insulin, or when there's not enough insulin, your body builds up with the glucose, and that affects body over time.
Two things: insulin, glucose. What are they?
What the sugar, your body, when you eat the food and all that too, the sugar is like the glucose is like a sugar form. It builds up into your body. The people say I have too much sugar in my body, so the insulin is the one that's supposed to break it down. Okay, so it's an enzyme that is made by the pancreas. It's supposed to break it down.
Oh,
It's supposed to work accordingly. One thing it goes into your body, it breaks into the glucose. The insulin comes in, bring it up, and then it goes into the blood cells for your body to work. So
oh,
basically,
okay, yeah,
basically,
enzyme,
when
yeah.
I'm in the
That was
car,
you.
I need the gas is my insulin to take me to the next place. And if I can't get there where there's no insulin, or if my body's not responding to the gas that's there, the car cannot move.
You preempted my question. I was going to say where the insulin is coming from, but that's an enzyme, and you say your pancreas
Yes,
produces the insulin, and it's the insulin that breaks down the glucose so that your body cells can use it.
yes. And
Oh,
naturally,
oh,
that's how it's supposed to work. But when that doesn't happen, that's when we start going into
and
diabetes.
this is important because the food we eat, because if I eat my rice and potato greens, my body cannot use the rice and potato greens like that. So we got to change it to sugar,
Yes,
and the
yes,
insulin get on the sugar so
yes,
that it goes into the bloodstream.
yes,
Oh,
yes.
wow. So our body doesn't really use the tteokbokki directly. You got to break it down.
No, it doesn't. It
Oh,
doesn't.
okay.
Whatever it is you eat, your tteokbokki or your rice or your sandwich or your pasta, whatever, it breaks it down because it's got to. That's how the body works. It breaks things down before it moves into the bloodstream and all that.
If you're here joining us, and if you're Liberian or wherever you come from, what is diabetes in your local language? That would be the question. If you know that, please write it. Or if you know diabetes in every other language, write it, because we want this to benefit everybody. Some people call it sugar sickness. Whatever you call it is what we are talking about. Diabetes, diabetes, diabetes. And def- diabetes, there are types of diabetes, right? Because and I came to know this very late in life, because when I was growing up, everybody who had diabetes was a big person, what we say, fat, with
Mhm.
big body. But as I learned later, is not so. What are there different types of diabetes, and where and
There
what?
are
Yeah,
there
what
are
caused
different
diabetes in the first place?
There are different types. There are different types of diabetes. Okay. For the purpose of this conversation, and we're going to talk like the two major ones. There are type 1 diabetes that is like totally insulin and dependent, and there's type 2 diabetes that people get later on in life. Latest, also called adult onset diabetes. But we've seen a lot of people younger youth now in their like teenage years, or maybe even before that, that coming down with type 2 diabetes. And there's also gestational diabetes that you get when you're pregnant, but the prevalent one is type 2 diabetes. Type 1 diabetes, it was originally called juvenile onset diabetes, is when, remember I told you about how the pancreas makes the insulin, and
Right.
the the pancreas also, the beta cells, there's certain cells that work in the pancreas that makes the insulin and all. Type 1 diabetes is when you're young, when you're much younger, you have like no beta cells. It's like it's autoimmune, meaning the body attacks itself by mistake. It's like it's the body for some reason. Autoimmune diseases, like the body sees something and it thinks that's foreign to the body, and it attacks it, so it destroys it. So when you're really young, when most of the time you don't know that you have it yet until the glucose builds up into your body. Until usually when you find out that a child has type 1 diabetes is when maybe they've been wetting the bed, they've been kind of groggy, they're not participating like they used to be when they're eating, and you see that they're not really gaining the weight even though they're eating that much. They may be thirsty, they may just they're not seeing themselves. And then sometimes some people don't even find out until like the child's like completely passed out. You go in the room to go wake the child up. The child is, and that's when the glucose have built up so much into the body that the body usually just kind of shuts down. And that's when you literally have to get that child to the hospital immediately for them to get them. They have to put them on insulin drips. So that's type 1 diabetes. And because of that, because they have no beta cells to secrete the insulin from the pancreas, nothing else will work. It's just insulin from the time they're young, from the day they're diagnosed to whenever anything happens. Put it that way, it's like a lifelong disease. So usually, type 1 diabetes is from the time from in juvenile onset diabetes. They used to call that before, but like I said, it's insulin dependent diabetes. And the problem is because of that, when a child has type 1 diabetes, or even one or two children in the family, it's really difficult on the family, because that one child, you have to really pay attention to that child. You have to make sure that child is taking them insulin the way they're supposed to take it. And with little kids, just to even give them pills and all that too, they don't want to take this. So just imagine they have to be stuck every time to get their sugar taken, because they have to get their blood glucose taken every morning, or sometimes 2 to 3 times a day. And their fingers, and that hurts the fingers over a period of time. So as any child, nobody wants to be different. So they may not take it, and it takes a toll on the family, because that child has to be going to the doctor to get checked. They have to see the pediatrician. They all just have to see the endocrinologist, because it comes with so many problems later on. So it can have like a really heavy toll on the family unit as a whole. And also the food that child has to eat, the whole family has to eat the same kind of food, or pretty much eat the same kind of food, because you can't have a child sitting there eating something healthy and you're doing something else. So that affects them. And even when they go away, for summer camps, for church camp, for any kind of activity that they have to go away from home, that can become very difficult. So, and unfortunately, there's nobody really know the real cause. There are theories out there saying it could be environmental, it could be from viral, it could be some other things that cause it. But right now, the main cause is like autoimmune. The body just attacks itself and just, and that's what happens for that. So, and that's what, because of that, we have to really teach the family members everything you have to watch for. And then when those kids become teenagers, that's one of the hardest part, because that's when teenagers really don't want to be compliant with their medications. And that's usually the hardest part. That's what most of the time they end up in the hospital frequently, because they're not really following the regimen that you follow so much when they were younger, but now they're old enough and they want to be, live their life the regular way. And you have to keep telling them, you have to take your medicine. You have to, there's no other way around it.
Are they born with this sickness, or it happens later on, or at what point?
Type 1 diabetes, it happens later on. And like I said, they're fine, but then the body, for some reason, the body just attacks the pancreas and just says, you don't belong here, even though you belong. Something happens and it just attacks. It's like with other autoimmune diseases, so it just attacks that. So most of these kids are like, diagnosed maybe like around age 2 to 3, little on, anywhere up until like by maybe 10, 12. That's what we call type 1 diabetes.
That's type 1.
Yes. And only insulin would do. And the problem, and we'll go back and we'll go into the complications later. So
what's about, is it hereditary, or your family member has it, or what?
Type 1? Not necessarily, because like I said, again, it's mainly autoimmune, but sometimes autoimmune diseases too can be hereditary. So yes, some people can have type 1 diabetes, and it can be also run in family as well. Yes.
You say autoimmune? What does that mean?
Yes. Like autoimmune meaning like it's like the body, you have your own immune system, right, and your body attacks your immune system. Like okay. Your immune system is supposed to fight for you, but the body, something happens there, and it's like I'm going to go out there. So whenever you get sick or whatever happens, you you get sicker, you get sick quicker. And like even now with the COVID thing, like that your body's supposed to be strong to fight anything, but your body can fight it because the immune system that's supposed to fight that no longer works or doesn't work effectively. So if I can just give you some Tylenol and say, go ahead, take care of that fever, that person may have to get like anybody, they're going to have to go to the hospital if they get too sick because the immune system doesn't work and the body just attacks itself by mistake. It just something just doesn't work. And you're still trying to find reasons behind that.
So that's type 1. What's type 2?
Type 2 is what they call adult onset. But like I said before, they're finding out in children who are like a little more obese or who are not eating healthy. Is when you get that later on in life. It's not the adult onset because they're saying stay away from stay away from saying adult onset because like I said, children are getting it as young as teenage years. But usually most of the time you don't even know that you have it. And that one is the one you still have the beta cells that secreting insulin, but the body's saying that like the insulin, is coming, but your body's not reacting to the insulin. The body is barely putting out any insulin. You still have your beta cells that put in some insulin, but the body's like there's no, it's not hearing it. It's not picking it up the insulin that's coming. So because of that, the glucose in your body is too heavy. It's too much. So because of that, you need to have artificial insulin to be put into your body or medication before you. It doesn't usually start with insulin. So usually, like I said, you have the cells, you have the insulin, but it's not enough for your body to receive it in order for it to work effectively. So and most people don't know, most people like you start drinking, it's called the 3 Ps of polyphagia. People drinking and not really eating. They're feeling tired all the time. You're eating a lot, but you find yourself gaining. You find yourself not gaining weight. They'd be like, "Boy, look at that when he eats so much, but he's just a skinny little thing." And sometimes even you're fat too. And also, like I said, your family member could have it. It's also really hereditary too. So. And over time, most people don't know until they go to the doctor's office. That's it for their physical, and we do their routine labs, and then we tell them, do you know your blood sugar is high? Then we do your A1C, which is the one that tells you where your A1C is, your blood sugar over a 3 month period. It tells you where you're supposed to be, and based on the numbers, that's when you know you're pre-diabetic, diabetic, or then that's when you get to a certain number, and then you need to have insulin.
So, and we'll come to those numbers really. So we talk about what diabetes is, type 1, type 2. Is there any other type that we need to talk about?
I talk about the gestational. That's the one when you're pregnant because your body's demand for more insulin, for more their body. So that the glucose builds up highly in the body because of that. But usually that's because when you're pregnant. And based on that, because you're going to be getting blood work very frequently when you're pregnant, so the doctor can take care of that. That can also be dangerous too, because that can also be dangerous to the mother and also to the baby. So make sure when you're pregnant, you're following your prenatal care you have to do it to the letter every time you're supposed to go see your doctors. And when you're due for any testing, blood testing, you make sure you're there every time and don't miss it. If you do miss it, try to get there as soon as possible because you have to make sure that based on the numbers, the doctors can take care of you better.
So what happens when you give birth? It stops?
Usually some people it stops, not right away. They'll still be, because you still have to follow with your GYN after you have it, and also they'll be following the baby too. But some people kind of eventually it kind of goes down. Your blood sugar goes to normal because your body is not demanding that much nutrients anymore. So the numbers usually go down. Some people do end up becoming diabetic later on too, or continue to be diabetic, but most times it kind of goes away, and then you may become diabetic later on. Because that's the risk when you run from being gestational diabetes, you run that risk too.
And we'll get to the treatment part later on, but as we mentioned, insulin, I know that when you take the insulin, that those who take insulin, sometimes the sugar level is up or down based on the insulin. So what really does this insulin do besides breaking down the glucose? Because
that's what it's supposed to do. That is the job of the insulin, is to break down the glucose in order for the blood for the glucose to go into your body. So that's the point. So when you take your blood sugar based on your levels now, the individual treatment based on what it is, that's when some doctors they'll tell you to do your blood sugar in the morning, first thing in the morning, or do it before, and twice a day, and then do it at bedtime. So when you first get diagnosed, we look at everything, we put you on a medication, and then depending on like your individual case, the doctor may tell you, okay, do your blood sugar every morning, keep a record of it in the next month or so, bring it to the office, and we see what it is. And then we'll start doing it from there. We may have to, change your medications around, but we don't usually start with insulin first. Remember that this type 1 diabetes is insulin from day one. For type 2 diabetes, you start with the pills first, and then based on the numbers, based on your A1C, is when we go into insulin.
A1C, if I remember again, there's an A1C number. What you say based on your A1C? Break that down. Is that a mean number that actually determines?
Yes, because we'll do for diagnosis. Are we going to diagnosis now?
No, but you keep mentioning A1C and it's confusing me.
That's because that's part of the diagnosis.
Okay. So we go. But before we get to diagnosis, let's come to the symptoms. If someone had diabetes, what would be the symptoms?
Okay. Similar to like I said to type 1, but it's different because type 1 just comes on after a while. Your body builds up with so much glucose, then it comes on when it shows up. But for your type 2 diabetes, your symptoms, polyuria, that's when you're peeing a lot. And peeing a lot will also mean that you may have urinary tract infection. So that's why we have to rule certain things out. So polyuria, like I said, the 3 P's: polyuria, frequent urination; polydipsia, that's when you're like abnormally thirsty. You always feel like you have to drink, like you're not and getting enough water in or getting enough fluid in your body. You just feel like you have to drink all the time. And polyphagia, like I said, you're very hungry all the time, but you don't see what the weight is going. I mean, if you already start off obese, that's different, but you just find yourself being very hungry all the time. You're eating all the time. Like somebody will say, wow, Dave, you really, that is I'll call your brother's name. You have a really healthy appetite, so you'll be like, yeah, that boy loves to eat, that boy loves to eat. But if it becomes like abnormal and you find yourself eating a whole lot and you're not gaining any weight, or you just find yourself to be very hungry all the time, that is concerning. Like I said, weight loss, you're losing the weight even though you're eating that much, blur vision. You start having some weakness and numbness in your toes and your lower extremities. That's what we call paresthesia. If you had a cut on your foot or anywhere in your body, it takes forever to like heal. You start like slow wound healing. For females, yeast infection, vaginal yeast infection is not a sexually transmitted disease. Yeast infection is when you have. Okay, I'll talk to women's health. And for men, Bilantis and bilinitis is when the forehead of your penis becomes becomes swollen, and that's when men have yeast infection too. So that's when you start noticing those signs, and like generalized fatigue, and you're just not feeling yourself over a period of time. Those are the symptoms to watch out for. For some people, like the neck area is like very darkened. That's and you start noticing that, like, or sometimes like hyperpigmentation around the neck and the back too, very different from your skin. If you're a black person too, it's much darker than your regular complexion. That's when you start noticing that. Usually we start noticing that when children start getting older. Pediatricians start saying that, and then also when you see other people too, you're like, that looks a little different. And somebody, you might think that's just hyperpigmentation, but I say bring it to your doctor's attention.
What's about sweating?
You can sweat. I mean, because what if you were in a cold climate, you may not be sweating that much, but I wouldn't call that too much. If you're not getting enough fluid in, you may sweat a little bit, but that sweating is not usually part of what we look at, but that could be part of it, but it's not one of the things that we look at.
So frequent, when you say frequent urination, how frequent should that be before it's considered a symptom?
Usually people go to the bathroom, maybe I'll say about 4 times a day as nurses or people in the healthcare field. Sometimes we can go 1 time a day, which is not healthy. But if you're going, like, you find yourself going to the bathroom, like you go pee, right? And you're done. And then you say, well, I got to go again. And 30 minutes later, and then another 30 minutes later, you find yourself going so much excessively more than what's your normal time you go to the bathroom. That's concerning. And that's outside of whatever urinary tract infection, if you have burning sensation and all that, or if you're male, you have issues with your prostate. But if that's continue going, bring it to your doctor's attention. Like I said, we usually, some symptoms kind of mimic other diseases. So we have to rule out certain things by blood work and by history taken, and then come to a conclusion and say, okay, this is what we need to test on. But usually when you come into the doctor's office with the symptoms, usually we will be doing it, like, urine tests, and also your routine tests yearly.
So before let's talk about risk factors, right? But even before that, if I've not gone to the doctor, can I know that I have diabetes based on those symptoms?
You wouldn't know that. You may suspect it, but you wouldn't know that because you have to have an accurate diagnosis in order to be placed on medications, or in order to say, this is what where you are right now. We want for you to eat healthy and try to exercise a little bit more or be a little more active. So when you come back here and we do your blood work again and we see where it is, then we can and proceed from there. But you wouldn't know based on that, because if you did think that you had diabetes and you weren't doing anything about it, that's even more dangerous. So you wouldn't know. You would come with those symptoms. I would say write it down and say, okay, how long, because we'll ask you, how long have you been and just been going on? Has it been over a couple of months? Has it been like a couple of weeks? Did it just start yesterday? So don't go running to the doctor right away. So, over like a 3 month period, or even when it gets to the point where it's so bothersome, I'll say go ahead and go to your doctors.
What are some of the things I need to be aware of so that I don't have diabetes?
Okay, so we're doing the risk factors.
Is that what you call risk factors?
Well, no,
Yeah,
risk factors.
then that's it.
Risk
Yeah.
factors. Okay, your risk factors, because usually there are people who say, "Are you at risk?" And there are people who are at risk, and there are people who are higher risk. Okay,
Okay.
so your risk, everybody's at risk for getting diabetes. So we're talking about weight. Like I said, you don't necessarily have to be obese. You see a lot, but if you're obese, the insulin cannot pass through, cannot secrete through all the fatty cells in order to bring your glucose down. So when you're obese, that kind of hinders the process also. And a lot of people who are skinny, I take care of, I have like a lot of minority population, a lot of Asian population that they're not heavy, and they have like a lot of people high. Diabetes is very prevalent in Asian population as well. People who have sedentary lifestyle. Right now it gets dark so early, so people are not going out that much. If you're supposed to be walking at least 30 minutes a day, or active 30 minutes a day outside of what you do. Let's say if you work as a nurse, or you work in somewhere where you're on your feet, outside of that. So normally 30 minutes a day, more, or more, if you can do that. And also do that at least 3 times a week. So sedentary lifestyle, if you're sitting around, you're eating, you're not moving around, that's higher risk because your weight will go up, and that makes it worse. Diet that's high in carbohydrates. If you're eating a lot of rice every day, a lot of pasta every day, everything that's heavy in sugar. If you're eating a lot of meat, red meat, that's also not good. Sugary drinks, alcohol, all those things are not good. Family
How,
history, that puts
how
you at
about
high.
how about chicken?
Chicken, if you cut up the skin from the chicken, and usually they used to say the lean chicken, like back home we said, the regular chicken, because they were fed just regular food over the place. But the chicken, regular chicken, because they have everything that they put in there to make them grow a little faster over here. So everything in moderation. But once you have a family history of it, like especially like a first degree relative, your mother or father, sister or brother, and sometimes even like a second degree, you're at a higher risk. So that puts you at a higher risk. So you got to make sure all these things that I listed prior, you have to make sure that you watch out for them and do them in order to prevent it or delay it as much as possible.
Wait a minute. If you have a family history of diabetes, you are at a higher risk.
You're at
I
a higher.
thought diabetes is not hereditary. So what my family history got to do with it?
Nope. Who told you it wasn't hereditary? It is.
Oh,
You talk
okay.
about you talk about type 1 that is autoimmune, that also can be hereditary. Diabetes, yes, it is. It does run in families, and you want
Okay.
to make sure, like I said, you had a
Which
higher
which,
risk.
which
You
one
have
runs in family? Type 1, type 2?
type 2 is hereditary. Type 1 sometimes. Type 2 is very hereditary. Yes. And also your age, as you advance in age, you get, like I said, adult onset, you have a higher risk of getting it, because by that time when you're in your 30s, late 30s, 40s, even your 20s, because I'm seeing a lot of patients that come in now and their A1C is like, and I'm going, you're in your 20s, this is what we're starting when you're in your 20s already. So let's start, working on this, because chances are they've been having this long A1C for the longest time. And when they come to me as young adults, that's when I'm seeing that. So advanced age, like your race, African Americans, Asians, Hispanic, Native Americans, and yes, Caucasians get it too. And then also, like I said, when you're pregnant, gestational diabetes. So those are the risk factors, the prominent risk factors that we look at.
So let's say diabetes does not run in your family.
Mhm.
Are you still at higher risk?
You're at risk, yes, based on your life, especially based on your lifestyle.
The lifestyle.
Yes, that's
So
when you.
it's
That's
like
when you're basically.
everybody's at risk then.
Yes, yes, everybody's at risk. That's the reason that is the reason why from the time you're young, we start telling you to eat healthy because when you're young, when you're in your teens and your 20s and, you're just living life, enjoying that's when most of the people don't even come to the doctor's office. Most people will go from the pediatrician and not come to the doctor's office until they're at least 30 or late in their 20s. So, and that's what we tell you from day one, try to eat healthy, eat things in moderation from day one, because whatever it is that you did in your 20s and 30s, it start manifesting when you get into your 40s. So into late 30s and 40s, and sometimes 20s. So that's why eating healthy and staying active as much as possible, we want you to start doing that from day one.
That is very important.
Yes.
Can this diabetes be treated and then you're well, no more diabetes? In other words, can we reverse it? You have diabetes and then you stop having diabetes.
Sometimes it's reversible. Sometimes, because depending on what your A1C is at the time of diagnosis and the complications at the time of diagnosis, it can be reversed completely, and also it can be lower to where you may not have to be on insulin anymore, and you may not have to be on pill anymore. It can be, sometimes we call that diet control diabetes, lifestyle control diabetes. So if you see your numbers if it starts really high and everything else that's going there surrounds that, then you can bring your numbers down. But sometimes, like I said, sometimes it's reversible and it can be controlled by diet and lifestyle. But
What
this
this may seem, that dumb question is like, what would diabetes do to you if you don't control it? I know you will die, but what else?
Okay, well, let's do I'll start with the diagnosis first, and then I can go into complications.
Oh, okay. Because I we're talking diabetes, and then I said, wait a minute. Is this something that I can manage and just be on with it, or what is it? What do I care? Or something that I can live with? Okay, but then let's go to diagnosis. If
Okay.
Because you call that complications, so I didn't even know that was the name for it.
Yes. Okay. So for diagnosis, like I said, most people don't know that they have it. When they come to the office for your routine appointment, we do your routine lab work. We do your CBC, making sure no infection, no anemia, and your CMP, just your electrolytes and your kidney functions and all that. So we do that. So most people don't know. Like it's asymptomatic, unless, like I said, your symptoms, when they start getting really, really into your body, when you start having problems with it, that's when you become symptomatic. But most people are completely asymptomatic until it's too late, until they get tested. So we do your fasting blood sugar. So basically, we tell you go to the lab, make sure nothing to eat or drink after 12 midnight. So when they do your blood sugar at the time, along with the other blood work, and if it's like greater than 126, it's not supposed to be greater than 100. If it's greater than 126, that would prompt. Yeah, or just we're doing it randomly, or let's say you're just sitting down somewhere and when you just do your blood sugar and it's like over 200, that would prompt us right away to go ahead and do an A1C, because sometimes based on your insurance and all that, it may be like, oh, well, it's a fasting blood sugar, we're not doing A1C if we don't do that, because it's an expensive test too. The insurance
Hold
will
on.
pay.
Is that the CBC or CMP?
The CBC is the one that does your white blood cells, your H and
Okay.
H, and all your other tests and checks for anemia and clotting factor and all. The CMP is the comprehensive metabolic profile. That's the one that checks for your electrolytes. That's your sodium, your potassium, your liver function, your everything else. It covers that. That the glucose falls into that. So when based on that, the glucose that falls into that, then that would prompt us to do the A1C based on what
Oh,
it.
okay. Or the
Yeah.
CMP, we check for the glucose, which is the sugar. So if that glucose is like 200, then we say let's
Just
do
like
your
they set up your
A1C.
random glucose. There's 4 different ways to do it, but most doctors just kind of go with like 1, 2. So based on that, when we see the number that high, then we say okay. And also, if you told us because when you come into the doctor's office, we also looking at your family history too. Might do a A1C for your routine test. So you're doing the A1C, right? So that it's also called glycated hemoglobin. That's the hemoglobin that's linked to the blood sugar. So when you listen to everybody as I say this. You have 3 different sides. It has a range. It's not just one number. You're normal, because you do need the blood sugar in your body 4.8 to 5.6. You're normal. You're not diabetic at all. You're fine. You're good to go. That doesn't mean you should go ahead and start eating everything under the sun. You'll be like, you know what? That's good. I'm not diabetic yet. That means I need to, work on that. Make sure I tell my patients, make sure those numbers are there. Keep that number where it needs to be. Okay.
Oh, and that's the A1C number.
Yes. Okay.
And,
So
and you say
normal.
that should be 4.8
4.8 to 5.6.
to 5.6.
Yes, you're normal. No
Okay,
diabetes.
that's normal. All right. I want to
Pre-diabetes.
be sure because we see these numbers and we don't even know what they mean. I have my chart, right? I go through my chart and they are telling me this, that. It gets so annoying. They are so confusing. I just drop it.
Your
So,
doctors don't. Your doctor
so
don't
I know
explain
there
it.
are some like me. So A1C, the normal is 4.8 to 5.6. That's normal.
Yes. Yes.
Good.
Okay. Pre-diabetes. Okay. 5.7 to 6.3
5.7
to
to
6.3.
6.3.
Yes. Right. That's
Then
when
you are pre-diabetic.
you're pre-diabetic. Now people see that and they be like, "Oh, pre-diabetes. That means I'm good. I can go on and all." But that's a warning. That's a warning point usually, and that's the point where we start medication anyway. Or if somebody's like 5.7, I may tell them, you know what, I'm looking at that number, and that's a little concerning to me. Um, Everything else, okay, your blood, if your blood pressure is fine, I don't see any other risk factors. I may say go ahead and eat right, take care of yourself, exercise, look at what you're eating, cut back on your cholesterol, your high fat, sugary drinks, and all. And in 3 months, we're going to check it. If that number continues to go up, now, of course, now the patient has every right to say, I don't want to be on medication. That's fine. We explain the risk and everything that goes, what happens when you keep your blood sugar is not controlled over a period of time. So 5.7 to 6.3, that's pre-diabetes. Okay.
Okay.
And when we start with diabetes, when you're full diabetes, it's 6.4 and greater. Okay, so that's when you're like diabetic, and that's when you're gonna be on the medication now to protect you, to make sure we don't run into complications. Now with 6.4, so when your A1C starts, when it gets to 9, that's when you have to start on insulin. Okay, so because then the numbers,
Your A1C gets to 9.
yes, then you have to start insulin. Of course, there are many other treatments, not just insulin, but usually that's the cutoff point where we have to start insulin. And then based on your risk factors would be what insulin, and there's so many other medications too that's not insulin but are injectables that you can take as well. Okay, so
Okay.
actually, doctor,
Let's go over that slowly.
okay.
First of all, you do your CMP and it's greater than 126.
It's 1P that the glucose is in your CMP. So
Right.
sometimes,
The glucose
yes,
as part of the
yes,
CMP is
yes,
126. Red flag is
yes,
get to 200 and say, well, let's do
yeah,
your A1C to actually know.
yes,
Right? We
yes.
do the A1C. Your A1C is 4.8 to 5.6. That's normal.
That's not.
You go home happy.
You'd be
But
like,
don't be
okay, yeah, like it's like the green light, but kind of towards the yellow light to say, be careful.
be careful.
Yes.
You come back, A1C now is 5.6 to 6.3, borderline, pre-diabetic.
Pre-diabetic, yes. And that's when we say time to, yeah, that's the guidelines call for starting you on the medication. And it's up to you. You can say no, I want to, and we'll tell you, like I said, we'll explain the risk. But you're pre-diabetic, meaning you're already there. You're like the red light, right? You're the yellow light leaning into the red light now. You're like,
Right.
okay, we're
And at this point, you
safe.
start the lifestyle changes, exercise, your diet, and that can help.
And if you were, I would say start doing that when you're normal. But yes, at this point, but if you're closer to 5.7 now, if you're closer to 6.3, you're already almost there. So
Mm.
that's why I say we usually, because the goal of pre-diabetes, the goal of protecting or treating pre-diabetic patient is to keep them from becoming diabetic. So that's why we start medication on that. Or we say, we're looking at this, we're really concerned. Your numbers are getting to where you're going to start having problems later on. You need to start doing something about it. And this medications is going to help you stay away from diabetes. It's not going to always do it, but it will help you keep you from there, in addition to eating and lifestyle change.
You're at 6.4 or greater, you're diabetic, and so we start you with medication.
Yes, but by then you would have started medication anyways in the pre-diabetic stage.
Okay.
Yes, and then when you get
But
to 9, we start with insulin. Now, if we do your first test and you're already at 9, because some people come in and sometimes you start looking at other things and you do the blood work and they're already at 9 or they're already over at like 11 or so. That is very dangerous. We cannot have you leaving the office with that number without putting you on insulin or other medication, other injectables out there that you can take. Because some insulin you take it once a day, some insulin you take it 3 times a day based on your blood sugar. And we have other other injectables out there now. When I say injectable, something you inject yourself with, that you can take once a week. You still take your glucophage. I'm trying not to call one medication here, but that's the guidelines. You take that. So some people will say, you know what, I'll just take the injectable that I can take once a week and I'll be fine with it and I eat healthy. So there's so many other ways that you can treat diabetes now that would make your life a bit more manageable and make things a little more manageable for you and your family. Because the most important thing is we want to make sure that you have the disease, but you're able to live a quality life.
Right. Ladies and gentlemen, this is Focus on Liberia in conjunction with Abby Tyler Healthy Living. We are discussing diabetes, and this is in commemoration of Diabetes Awareness Month, which is the month of November. By the way, Abby is FOL Health Contributor. So you have diabetes now, and so what you need to do is to manage it. But let us know, we discuss the diagnosis. Let's go to the complication. You have diabetes, and then what happens?
Well, now that you have diabetes, the complications, you can ward off the complications. Okay, it doesn't necessarily mean you're going to get them, but the problem is, hold on a second, I'm just trying to, so I can read in order here. Okay, hold on a second. In my diabetes, sorry, I type everything up so I can read this a little neatly for everybody, so I'm not just talking there. Okay. Alrighty. So, like I said, the complications. All right. Anybody see my profile picture, they can see that. So, but diabetes over a period of time, you run into complications at diabetes because the eyes. The first thing, diabetes is like the leading cause of adult blindness because it affects the small blood vessels in the eyes. It's called diabetic retinopathy. Okay, so you want to make sure when you have diabetes, all our patients that have diabetes, we send them to the eye doctor at least once a year. You have to follow with the eye doctor once a year. Okay, or the eye doctor may say come back a little bit more often because you may have other issues too. So once a year, you may say I don't see anything yet, and you don't start feeling anything, but it's closely affecting your small blood vessels. Also, we're talking about it affects your kidneys over a period of time. Okay, and because that's part of the small vessels affect the kidneys, and you start going to chronic kidney disease. It starts affecting your feet and all that. The sensation in your feet when you cut your foot or something happens to your foot, you stump your toe, it takes forever to heal. That's what we call diabetic neuropathy. Okay, so that affects that over time. So usually we make sure all our patients, we send them to the podiatrist at least once a year. And I tell my patients every day when you take your bath or whatever it is you do, you wipe yourself down, you're making sure you have a mirror or you have somebody, but it's best when you have a mirror. If you can't see clearly, you have a mirror and you look on the bottom of your feet. Don't just look at it from where you are. Look at it completely. Look at it. If you can do it every day, look at it frequently. Make sure there's no discoloration. There's no little cut there that something's, or you're feeling the sensation. You start missing some sensation, or you hit your foot and you didn't really feel it. Also tell you not to walk around with flip-flops, especially in the house or somewhere or walking in the fields where you can hit your toe and get. So you want to make sure that you check that every day and bring it to the doctor's attention. So we send you to the podiatrist, and then also once a year, we'll send you to see the kidney doctor as well. Then we'll start following your kidney level, stage 1 kidney disease, stage 2, and when you get to certain numbers and all, based on that, hopefully you don't get that far that you have to have that you have to start dialysis. So
how does diabetes get to all these areas? Foot, kidney, and all these things. What's the connection? Eyes?
Because what it does, over a period of time, when the glucose in your body, uncontrolled diabetes over a period of time, and sometimes even if it's a control, you can still have the complication. But over a period of time, in all the increased glucose in your body, it goes after the small blood vessels, and then it also goes after the big blood vessels. Like I said, it goes after your eyes, and it goes to the kidneys, then it affects the larger blood vessels in your feet and in your legs and all, and then also attacks your heart. That's when people have a high risk of having a stroke and also having a heart attack, because it hardens your arteries, and the high blood glucose, if it's not filtered out of your body, because your body cannot function with a high glucose count. Okay, that's the reason why the insulin and everything, healthy eating kind of works with that. That's the reason also we make sure that if you having that, you're making sure that you keep your cholesterol level down, because cholesterol also works on that, making sure you keep your weight down, and also it affects your mentality too. All of that. It's such a disease that is so all encompassing, and it affects the entire family. So there will be times where you have to also see a therapist, because sometimes you may not do it. Not so much therapist, but like a control, like like a group where you can go to and say, hey, let's you sit there, and self-help group, put it that way, and sit there and say, go, they send you to different diabetic classes where other people have diabetes, and you can sit there and talk about it and say, okay, what are you doing to make things better? What are you doing? And sometimes when you listen to other people and what they're
Right.
doing, that can also help you too, so you don't get depressed that you have so much to do. And it's just that the fact that you have to go to the dentist, you have to go to the eye doctor, the podiatrist, the nephrologist, which is the kidney doctor. Sometimes you may have to go to the neurologist and all. So all of that can become a little bit overwhelming. So it's good to have
Right.
somebody else to talk to. So we usually can
Well,
say,
I
if you
mean, that is. I
just
mean,
do.
I'm knowing this more and more, and thanks to you for the education. I also learned that you need to go to your urology if you're a guy, because
If you're
erectile dysfunction.
okay, yes, yes, because after a while there's sensation. And thanks for reminding me. Hello, people, men, women. This is the national November is also National Impotency Month. So that means, for those of you who have issues with erectile dysfunction, it mainly when erectile dysfunction is maintaining, getting up and be able to maintain it for a period of time. So let's say some people can go for 10 hours, and whatever your norm is, and you start noticing that you're not getting to that point anymore, and your partner starts complaining and saying, you know what, wow, that was like what? Yeah, you start having issues, and you're as a man, and you mean like your partner will be like, well, is something going on? First of all,
I
they'll be
mean,
like,
this diabetes is everywhere. I mean, even
yes, for
up
men,
to that.
and for men, that's the only time they really pay attention.
Yeah.
Because it'd be like,
That,
oh yeah, you could hurt your heart, you could do this. It'd be like, and I'd be like, oh, and that could really hurt that too. You'd be like, oh, oh, okay, 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 oh, okay. Well, we don't want that. So even because you want to make sure that, because if you lose the function, even I know Liberian people like to say, oh yeah, you can get a bit of cola. You can no when that circulation is like completely not connected anymore, you have to follow up with the urologist to find out.
this
And
is serious stuff.
yes, it is.
What diabetes got to do with it again? Is it the blood is not circulating, or
The blood
how?
supply, yes, yes. If you start losing and sensation and everything in your lower extremities, because I mean it's all in the hip area, and start going down to your lower extremities, because the heart is not pumping out that much anymore. It affects the heart over a period of time, so you start losing the sensation there, and all. Then blood supply, decreased circulation. That's when you start having wounds on your legs and all, because you're not getting enough blood supply there after over a period of time.
Let's go to the prevention and management, because this is some scary stuff.
Well, prevention, okay, prevention. Nearly, I think we kind of, kind of touched
Yeah,
on it. Prevention
because
means, like I said, if you're overweight, try to lose some weight. Try to get down to your ideal body weight. They had the chart. I put it on my forum a couple of times. The ideal body weight, but we don't pay so much attention to the ideal body weight, because when it first came out, first they didn't take into account ethnicity and everything else. And some people who were born big, will never be skinny, will never fit into the ideal body weight. But usually we try to keep people around there. Ideal body weight is anything from 19 to 25. You don't want to be too much lower than that, because you don't want to be too skinny to where you're not healthy enough. But some people, that's where they live. They've been skinny forever. And there's some people who, like I said, been over 25. And but when you get to that point, we want to make sure we keep you. And if you're like 30, 35, 40, that gets a little bit more dangerous. So if you're heavy, lose the weight, try to eat properly, making sure, like I said, and lean carbs, lean meat, chicken, dry fish, boning, things like that. Lot of seafood, lots and lots of seafood. If it's no ocean, go ahead and get it, ocean or stream, wherever it is. So go ahead and get it. But try to cut back. We put so many things in our soup. So don't do much of that. If you eat rice, eat a little bit of rice, or don't eat too much rice every day. So portion control at the same time, quantity. Exercise at least 30 minutes a day for 3 days a week or more. If you can do it, do a lot. Some people don't like exercising at all. Do your dancing. Full disclosure, I have been donating to Planet Fitness now for the past year. I haven't gone. So every time I've been to my walk there, but I haven't gone. So every time I plan on doing it because of my job now. So it's kind of hard to like leave and then come to want to do that. If you smoke, stop smoking, stop smoking, stop smoking. Making sure you follow up with your doctor's appointment to make sure you're checking your heart, your blood pressure. Making sure sometimes, like I say, you may have to go to endocrinologist too if your blood sugar, we can't control it in the primary care setting. We usually send you to send you over to the endocrinologist so they can do some other stuff because sometimes something else is going on there. If you drink, cut back on that. Dash diet, like I said before, you can go online, look that up, is dietary approach to stopping hypertension, because you want to make sure, again, like your blood pressure is low. And also know your family history. You must know your family history to say, some people, like I said, will come from a culture where nobody wants to tell anybody anything. Oh, that person is lying. Oh, that person just did this. Oh, and it's like, oh, it's either witchcraft or it's something else. But
Right, and that's what I was about to ask. How much of this diabetes got to do with witchcraft? Because now they see me in America. Does witchcraft cause diabetes?
No, I don't know witchcraft, so I can definitely say that, but no. I can only work within my scope of practice,
Okay.
and I appreciate, and part of my scope of practice is appreciating and respecting other people's culture. But at the same time, I can say these are the things that I'm looking at. These are your test numbers here. This is you on the scale. This is your blood pressure. This is your test results. These are objective information that I can use. And I take your history, your culture into account, but these are the objective information I can use in order to treat you. If you feel that somebody else, and like I said, I tell people, if you can pray, go ahead and pray. God will tell you, got to get up. Even pastors, I've taken care of pastors, I've taken care of priests and all that, and they get sick, they come to the hospital. And they also, when I do the discharge instructions, and even during the time they're there, I'm telling them, this is what you're supposed to do to eat, this is what you're supposed to do to stay healthy, in addition to your praying and all that. So they know.
Right.
So witchcraft, I don't know.
Oh, okay, yeah, because anyway, but we don't know. So,
We don't know.
And we are talking about managing it. Can we, immunization help? Can you get immunized against
You can.
diabetes?
Why I put the immunization there is to make sure that you keep up with your immunization.
Okay.
Because let's say, especially as a adult, you want to make sure you keep up with your hepatitis, but most importantly is your flu vaccine. You want to make sure you get your flu vaccine every year, because like I said, for diabetes, for a diabetic patient, you get sick and it takes forever. It takes a longer time for you to get well, because your body has a harder time fighting any kind of infection. So you want to make sure that any kind of opportunistic disease that there's a vaccine for, you want to make sure you immunize yourself against it in order to stay healthy. So that will also call into COVID and all. Of course, talk to your doctors about that and making sure you know.
So weight reduction, the proper nutrition, regular physical activity, and all these things.
Use cardiovascular. Usually, most people also have high blood pressure too. So most of the time, the guidelines, we have to put them on medications to control the blood pressure, because all of that long-term high blood pressure also leads to stroke or heart attack. So that goes after your major blood vessels too. So we have to make sure that we aggressively control that.
Diabetes and high blood pressure, sometimes they work together. Why is that?
Definitely. Because I mean, like I said, once again, we go back to the glucose. Your body cannot take that, and over time, it kind of hardens your arteries. It causes higher cholesterol and all. So when your cholesterol level is high, your blood vessels, that cholesterol level stop forming plaques into your blood vessels. Your blood is supposed to flow beautifully through your blood vessels. If any kind of block there over a period of time, your blood pressure goes up. And also then that also your cholesterol level is high, and then diabetic numbers start going high. And usually that's why I said you have to control it through making sure you don't, for the retinopathy for your eyes, nephropathy for the kidneys, neuropathy for the feet, and also for your heart, and control your heart and your kidneys and all that. Because it is an opportunistic disease, so it affects all your major, like most of your major arteries and most of your major organs, and the lower ones, not lower ones because they're all like important, but it's like all comprehensive. So you want to make sure you take care of all that. You're taking care of the whole patient when somebody has diabetes. It's not just something where you can say, oh, well, I have a disease, and now I don't want people worrying too much about it. But at the same time, it's a different kind of lifestyle when they tell you that you have diabetes, what you have to do to keep yourself healthy and to make sure you don't have those complications.
So if you were comparing, blood pressure or hypertension and diabetes, it looked like diabetes is even more, right? It's hard to take care of, and it affects too many things compared to any other disease that I know of. Is that a true statement?
It's manageable. It's
Okay.
manageable, over a period. It's manageable if you do all the right things, but it's like I said, it is comprehensive. It's a whole lifestyle change. Like I tell people to be
Mhm.
like, oh my God, I'm not going to go on a diet. Oh, I'm not going to do that. And it's like, no, 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 no. We're not telling you that. All we're telling you is this is what we have. This is what we're looking at. If you do all these things, you can delay all these complications as much as possible. And you can make sure you don't have to change your life so much, but you can do those things that you used to do before. Like you can just eat anything you want to eat before. I remember I went to this party a couple of years back, and many of the like people there, like people were diabetic, and they kept saying, "Oh my God, I'll just eat my food and take an extra this. I'll just do this and take my extra cholesterol medicine." And I was sitting there. I mean, they were older ladies too, so I just said, I said, "Well, don't eat too much of that now." And sometimes, our culture, you can get into people's medical stuff, even though they just volunteer the
Right.
information, but you have to know that person to know how to say it. So it's just important that it's a different kind of lifestyle once you get it. So that's why it's very important that you try not to get it because it will affect your life and your family members too. So as much as possible, try to control it and try to delay as much as possible. Doesn't mean you're always going to get it, but everybody's at high risk, and then you have higher risk if you have family history and other things that I mentioned before.
So diabetes got no cure. We're only managing it.
You can manage it. You can manage it. You can reverse it to
Mhm.
where you don't have to be on medications anymore, and then you just control it through that. But most people, when you tell them you don't have to be on medications anymore, then they just see that as green light to go back, and then no, then eventually the numbers start going back up again. So
Wow, diabetes. There are plenty of questions here. Let's talk about the food. There are many questions here about food. What we're supposed to eat, what are we not supposed to eat, especially to prevent or manage diabetes.
well, like I said, if you eat rice, which is then they tell you cut back on the rice, and
What about sugar? The sugar
because the
donuts, or we put
rice will
sugar
break
in our tea.
the thing about it is the carbs, because the rice will break down to sugar. All of that will break down to sugar into the glucose that's supposed to go. So don't eat too much sugar. Some people have their coffee and they put so much sugar in there, or tea. Cut back on your sugar. I usually do the natural sugar. I don't like the different sweeteners and all that too, because they also have their artificial stuff in there. So
What is natural sugar?
I mean, I think the sugar, like the brown sugar, I use that's what I use. I use brown sugar.
Mhm.
Anything that isn't, I don't use equal. I don't use, but sometimes when you become diabetic and or you brittle diabetic, you may have to use some of those artificial sugars. So that's different. But
Yeah.
if you do
No,
rice,
I drink coffee every morning, right?
mhm.
So I sometimes use honey, and the honey is like no different from sugar. And or I use the condensed milk because I'm thinking, okay, it's not direct sugar. What
That's
should I
what
put? What should I put in my coffee in the morning?
I say just sugar. And if you're just drinking 1 cup of coffee a day, it's not bad. I'm just some people drink coffee like 3, 4 cups of coffee a day and put a lot of sugar and a lot of cream. I usually just put like 1 spoon of sugar, even if it tastes bitter. I've gotten used to the fact that it may taste a little bitter. It doesn't have to be as sweetened like when I go out to buy coffee somewhere else, which I don't do that often because I know I have to cut back on my sugar. And just put like 1 cup of sugar, put some, I put a lot more cream, but I use non-dairy cream. So that way I'm not adding too much. If you eat bagel, try to eat wheat bagel. Even if you eat a regular bagel, don't make it every morning. They tell you eat your breakfast as a king and eat your dinner as a pauper. So eating a heavy food during the day. So when you in the evening you eat light food. So that way, because most people will eat and then go to bed or sit down and watch TV. So when you're not moving around, all that food that you just ate, it just stays on your body and it just turns into all the glucose and fat, and then your body's not working it off. So eat heavy during the day, work it off, and then eat light during the evening, if that's possible for you.
I'm using myself as an example. Right now, I work from home.
Hmm.
I live in a house, so I come downstairs, work 5 o'clock, 5:30, 6 o'clock, eat fufu or cassava and rice, sit in the living room, watch TV, and the next thing I'm upstairs, I'm going to bed. From what I'm hearing, that is bad.
That is bad. That is bad. Especially for those of you staying at home and working all that, to find time to walk outside or get a treadmill or get something, home gym or something, anything cheap. And there's so many things online on YouTube that you can just put it on and do this exercise from there. You don't necessarily need anything really expensive. So don't eat too late, especially if you like from home. Don't eat too late. And then if you do eat, go for a walk, do around the house, do some cleaning stuff. Just as long as you're working it off to work that food out of your body, so you're not just eating and going to bed. So if you're staying home and you one of those people can come home, if you're lucky enough to come home before 5 to 6 o'clock, eat around 4 o'clock. And then if you do have to eat at night, eat like, light snack, put it that way. Don't eat
Yeah.
soup and have a bowl of rice right before you go to bed. No, that's not healthy.
Yeah, I have my friend I call sometime after the show and I say, how was the show? And he say, I hope you are not eating fufu right now. We'll take a short break, a few seconds break, and we'll be right back. When we come back, we're going to read our comments and get from, and questions.
My name is Talvina Cole. I am an activist, and you're watching Focus on Liberia.
And I'm Dennis Jha. We are live from Atlanta, Georgia. Focus on Liberia in collaboration with Abby Tyler Healthy Living. We're doing diabetes awareness. If you have someone with diabetes in your family, or a friend, a family member, a neighbor, please pass this information. This show is going to be on YouTube. It's going to be on Facebook. It's going to be on Twitter. Go back to it and learn something about diabetes that you haven't known already. Lasana Kamara says rice is one of the bad food. Is it because of the carbohydrates?
Yes.
White rice, brown rice, jasmine rice.
People say they eat I see a lot of people eating buckwheat. I never had that before, but I think they said that became popular during the war. Yeah, that's really healthy. So if you're gonna eat rice, eat brown rice, or any rice that's enriched, but it's still brown rice. And the thing about it, brown rice can be a little expensive too, but brown rice. But even if you have to eat rice, just like I said, portion control. Because if you're from a culture that eat rice for you as your staple, you're not just gonna stop it. So portion control and the quantity and the frequency and all that. So you want to cut back on that.
Momolu Sonny, I think when we're talking about the erectile dysfunction, you said type 2 can affect that too?
Definitely. It's, sensation, circulation. Just remember that, sensation, circulation. Is type 2 the reversible? Yes. Sometimes it's reversible, depending on what your numbers are at the time of diagnosis. If it's very, very high and all that, and you don't lose the weight. And some doctors now, they're doing the gastric sleeve, where usually when you start having high risk of certain things like family history, they can do the gastric sleeve where they can control your eating, make your stomach pouch so small so you're not eating that much. But yes, it's reversible sometimes, depending on how far advanced it is.
Jawon Jase, what are some of the food stuff that we need to cut down some of those problems?
Again, rice, white bread, anything that's white bread, white bagel, white pasta, white rice, all those things, you have to cut back on it, especially when you do have the disease now, then you really have to cut back on it. But you want to cut back on that. Sometimes you can ask a dietitian. The thing about us and the dietitians, they know all the exact numbers, like the grams and all that. So sometimes we might send you to see a dietitian where they can go over the kind of food that you eat and just kind of tell you exactly what it is, how much portion control. But normally, of course, don't eat rice 3 times a day. Don't eat heavy rice before going to bed. Eat a lot of fruits and vegetables. Eat salads. I know people don't like salad. So as for me, I'm not crazy about salad, but I'll eat it. If I know I have to I'll eat my salad first and I'll eat my rice. Then that way, at least I know that I ate something healthy. So that salad or that roughage can help get that food out of your body quickly as possible.
Same question on food. Does diet contribute to the diagnosis of diabetes?
Yes, high carbohydrates, all those different things. Unhealthy diet lead to high blood glucose in your body and higher A1C.
I believe all governments should invest in this disease to find a solution for this kind of disease. Why world leaders are not responding or doing this as a national issue to kill this diabetes?
We are. And the The governments are doing everything. What the World Health Organization, the Center for Disease Control, the United States Preventative Task Force, the CDC, American Heart Association, American Diabetic Association, all those people, they're all government, and also the Global World Health Organization. So they're doing everything, and there's every day there's research going on. That's people don't see the background that's going on. There's research going on every day. That's why sometimes we get different guidelines every 2 years, every 3 years, and some people say, oh, they say we should eat this, and then now we shouldn't eat this, and this is good for you, this is not good for you. That's because there's research going on every day, and there's so many companies that are doing research, and government that are doing research too. So it would be nice to find a solution, but until then, we have to control it and manage it.
Jackie Jackson asking, what is real high numbers? I don't know, when we're talking about the A1C, I don't know if that's the question you think?
Yes, I guess I think that's what she's talking about. But I went back to it, right? You're anything greater than 6 point, because that's it. So
right. 5.7 to 6.3 is pre-diabetic.
Yes.
If A1C is 6.4 and greater, you are diabetic.
Yeah.
If it is 9, you are really in trouble, and we need to start you on insulin.
Yes.
Right away, if we've not already started.
Yes.
So those are the high numbers. Does exercise help with treating diabetes? How much exercise is needed to promote good health for one at risk of diabetes? What food help fight diabetes?
Fruits and vegetables. You want to eat fruits and vegetables. Don't eat too much sugary fruits though. Eat a lot of fruits and vegetables. Eat a lot of salad. I see some people eating salad, but then they put so much dressing on there. So make sure you're eating salad and you put in some lean dressing on there, non-fat dressings. Don't make it soak in the stuff. Eat it, eat that before you eat your rice. Cut back on your rice again, and go back. And we say that every day. Portion control, portion control, portion control. Because I've seen some people and they see the rice on the plate. Also, like when you go to parties and then dirt, and sometimes they have stuff that people put so much, like eat the rice bread, you eat the cornbread, it's like so much starch on one plate. And I was like, then you got to go back for the main course. So even when you're home, at the same time, you want to make sure that you're cutting back on your stuff and exercising. Heavy exercise and brisk exercise, 30 minutes a day, 3 days a week, or more if you can.
Right. Doris Smith said, I've been diabetic since 1998. I have managed it and I'm fine. I'm on pills. That's it.
That's good. That's good. So, yeah, that is really good. I mean, since I don't know how old you are and all that, but that's good.
What's about caffeine?
I mean, like I said, one cup a day, because it's not just the caffeine. The caffeine will make you jittery too. And if you get jittery, you get too much caffeine will make you jittery. And chances are you probably won't be eating healthy. But 1 cup a day, 1 or 2 cups a day. And it's not just the caffeine. The fact is you're putting a lot of sugar and you're putting a lot of creamer in there. So whatever goes along with the caffeine is what you want to watch. And also you want to make sure the sodas, non-caffeinated beverage and all, and less sugary drinks.
Jimmy Eastman said, what happens if your pancreas stops producing insulin? Can it be restored?
No.
But you can get pancreas transplant.
I've never heard of it, but the thing about it, the pancreas is such an important organ. It's such an important organ. That's the reason why, God forbid, if you get pancreatic cancer, the lifespan of that is very, very shortened. So the pancreas I haven't heard of pancreatic stuff, but no, once you get there, when it stops producing it, you have to be on insulin. Because if it stops, especially type 1, when you don't even have it, then you have to be on insulin.
Lasana is advising, in order to help, please don't eat rice after 9 p.m. Now it's even too late. Somebody telling me to get a bite.
Nothing heavy to eat. Nothing heavy to eat 2 hours before bed. So, but then people say, well, my bedtime is 12 o'clock. But, that's, so just make sure don't eat anything too heavy. And if you have to eat a snack, like I said, just eat 61 years old. Okay.
Yeah.
Okay, good. Good for you, Doris. Keep it up. That's good. I'm good. I always congratulate my patients who are doing good with the numbers. That's very good.
Gabriel Cholo, can you please talk about seafood again? I didn't get the first explanation.
Well, seafood doesn't have that much fat in it. Like your fish. Remember back when we used to eat a lot of fish and all that, and we did it. We walked everywhere. We went playing boys went and play soccer, and girls were playing outside, and women were doing that. So a lot of seafood is very good. Seafood doesn't have all of that and heavy fat like in the meat and all that. So it's good. Fish, don't fry the fish. Make sure you broil it or bake.
No, air fry it.
Yes, or air fry.
Air fry is good now. I love it. And look, if you the green plantain, if you air fry it, it's like you really the way we really used to roast the plantain back home.
Yes.
Try that. Air frying the plantain, that's good. We have more that we talk about exercise here. How much exercise is needed? We spoke about that. Yeah. And guess what? Teresa said Nurse Abigail is an experienced and dedicated nurse.
Oh my God.
I'm a witness.
I have to say, Teresa is one of the. I used to work with her, and she's one of the publisher of the new cardiac regimen guidelines. I know somebody. She is very important. So when anybody says anything, I can say I know somebody very important because it's through her the guidelines that they wrote, the American Heart Association. That's what we're going to be using in office. Providers are going to be using. So congratulations, Teresa. And also, Teresa is very a good friend of the Liberian community in Bucks County. She does a lot of things for the immigrant community. So she's big time.
Thank you, Teresa, for the work you do. And come and join us, so we can have
a show. She knows a lot.
Yeah, because Jackie agrees with that. Yes, she's surely experienced and a great NP. And by the way, our phone lines are all set. You can call in. The number is on the screen there. Call in and take part in the discussion here. Let's have a discussion. Again, the number is 605-313-6004. The code is 791403. Call, ask a question, share an experience, give an advice, contribute to the discussion, and say something. This is all learning. And then we can ask questions and learn from one another. So thank you very much for the information here. Momolu say, what are the Asian community doing differently? They eat a lot of rice and not affected like the African community.
Oh, they're very affected. There's a high risk rate of type 2 diabetes in the Asian community. Very high rate. So sometimes it could just some certain races have different way where the body process certain things and all that. They do have a really high rate of diabetes in the Asian community. So I mean, I think also the fact that they don't really fry too many stuff and all. They do eat rice. They do a lot of walking around too, but for some reason they do. They're smaller in size, but there's a really high rate.
Lasana is enjoying the show.
Thank you, Lasana.
River says, "Pro, great topics and show." Lasana is asking if I don't know if that's you or Teresa have a contact on Facebook. You can go to Abby Tyler Healthy Living. You can
join,
page,
like and follow. You can send me a message. Also, my Abby, you can look for me on my regular name, Abby Tyler, my profile stuff, Abby Tyler. Just contact me. I can give general information to people. I can give specific information because, once again, there's ethical reasons that I can't do that, and legal reasons why I can give specific information, but I'll be more than willing to lead you towards the right way.
And James David is watching us from Harrisburg, Pennsylvania.
Thank you, James.
So Abby, we talk about, what are some of the cases, that you what are some of the things really that you've seen or heard of or read about that this diabetes can lead to if it is not managed properly?
I see a lot. I mean, I've seen many patients. The unfortunate thing about type 1 diabetes also is the fact that because they need insulin so at such a young age, and not only that, the complications come quicker in life or earlier in life because for a longer time, that long of a period that your body is like not your glucose impaired or insulin impaired and all that brings the complications. So blindness, usually by the time like in their 30s, they start having problems with blindness. They start having problems with their kidneys. Some people, type 1 diabetes, diabetic, usually start having kidney issues where they may lead to dialysis very early because of kidney failure. A chronic kidney disease that does lead to kidney failure if it's not managed well. Eventually, it just does. And also, like I said, the amputation, because most people start off with a little cut in their foot and they be like, okay, that's all right, you know, and then it takes forever to heal it, and they're not following over the doctor or not following over the wound care, like we said. And then eventually this sensation, they don't feel it and they hurt their foot even more. Then it started with like amputating the foot, amputating. And like I said, it's a really expensive disease, and also it's a life-changing disease, because if you're an adult and you're an adult who taking care of your family, you're a man or a woman who, you know, caregiver in your family, and you start having issues where it start affecting your eyes, you start having issues with your heart, or you have a stroke, or you have, I mean, just the kidney stuff that takes over your whole life, and you have to stop and be going for a doctor's appointment and doing this and doing that, and that can affect your job, because, you know, especially if you work in America, if you keep calling out over a period of time, they're going to say, okay, well, maybe you don't need to work here anymore because we need somebody who will be here. So the best thing is, you know, try to delay as much as possible. And if you have a higher risk, try to make it delay as much as possible. And if you do get it, you want to make sure you control it as much as possible, because it can go from something very small and manageable to something completely that changes your life. So that's the most important thing, is to try to, you know, control it and try not to get to the point where you may be diagnosed with it, and know your family history.
So right now, let's say I'm managing my diabetes. Is there any food that I can eat to bring this down, or, you know, root bottle, or, you know, what are some of the things, maybe homemade, and also maybe food? So yes, I was eating too much rice.
And you cut back on your rice.
Yeah, if I cut back, what do I need to eat that will help control it?
I mean, like, you know, going for my non-American, non-Liberian audience, I'm gonna get to the culturally relevant part of this. Even with the regular people, if you're eating, like I said, anything with heavy sauce, if you're eating palm butter every day, you'd only be eating palm butter every day, because that's got every heavy oil in it. And I know people say, Dr. Asa, we can, you know, red oil is good for you, palm oil is good for you. 1 teaspoonful of palm oil. How much can that be for Liberian food? That's what? Nothing. So if you're eating food with heavy food like cacao leaf and palm butter that have heavy oil content in it every day, no, you want to cut back. Eat some pepper soup because it's light. It can go down your body. It can get out of your body. Eat some salad because you want to eat a lot of raw fish, or some, you know, like fruits and vegetables that can help it. Drink a lot of water. Eat a lot of other things. So when you're ready to sit down to eat your meal, your whole meal, you won't be as hungry. You know, and like I said, you can also ask your family doctor, or if you do see an endocrinologist, you can say, you know what, can you give me a number, or you give me resources where I can go to a dietitian, so that person can sit down there. I can tell them this is what I eat, and they can tell me exactly what I'm supposed to eat now, because I'm diabetic. So this is what I'm supposed to eat, and they can cut back and can tell you exactly. But because basically we tell people heart healthy diet, cut back on your rice, cut back on your carbohydrates, cut back on your bread, your white pasta. If you eat a lot of pasta and sauce and all that, to cut back on the sauce. Everything you look at is, you say low fat, don't eat too much chips, and make sure if you're going to eat chips, it's baked. If you're going to eat, even eating potato chips, sometimes you have a whole bag of food and you'll be sitting there, and you get hungry. So you just eat and you continue eating because you're sitting there, you're hungry. Put it in a little sandwich bag, you know, and then put the big bag somewhere else, put it back there, and you sit down and eat. And when you're done eating, don't eat anymore. You know, some people are like, oh, I want to get a little bit more. I mean, you can sneak and get a little bit more, but once you're diabetic now, you can't do that, you know.
And we got a caller on the line. But this question says, can type 2 diabetes change to type 1?
No, once you're type 1, you're type 1. That's something you get when you're real younger.
Then when you're type 2, can you be type 1 at some point? The answer is no.
Type 1 diabetes, you get that as a youngster. You get it as a child. The childhood diabetes. It used to be called juvenile diabetes before. No, type 2, you cannot, because once you're type 1, insulin, finish, you have no beta cells, you're not secreting any insulin, period. Type 2 is the one where I said, when you start with, you know, you have insufficient beta cells that secrete the insulin, and that's it. So it's two different things. Both have almost similar complications, but right. No, you can't go from 2 to 1, because you have to understand the insulin part. Like I said, insulin is type 1, no beta cells, period. None. The body attacks itself, you have none. Insulin forever. But you still have to eat healthy, and you still have to make sure you delay the complications too for type 1.
Let's take a call here. Call out your name and where you calling from.
Yeah, this is me, ABL. I'm calling from Milwaukee, Wisconsin.
Abraham, welcome. Thank you for calling. Question or comment?
Yeah, I got a question for her. Recently, my doctor told me that I'm at a borderline when it comes to diabetes, and because I just did my blood work, but I get home from work at 2 o'clock in the morning. Well, my regular hour is from 2 to 10, but sometimes I stay late. Overtime, I work from 2 to 10. So, and I can't just resist when I get home. I get hungry at 2 o'clock or 10 o'clock, and I have to eat rice, or something heavy, because I feel hungry. And like the salad and other food you talk about, I'm not just used to it. Rice is our stable diet. So, what advice do you have for me?
Thank you.
So those who work, that's the problem with certain diseases, because the lifestyle makes it more difficult to manage. But if you're eating that heavy and you say you're going to work from 2 to 10, then you want to make sure that when you wake up in the morning, you're going to exercise. You're making sure in the morning that you're incorporating exercises every day. If your doctor told you borderline, so you're probably pre-diabetic right now. So you want to make sure that you exercising, and even if you can still eat really heavy in while you're at work, take your food at work and eat really heavy. So when you come home, you're not eating. I know some people don't want to take certain food to work and all that, but eat heavy at work, and then eat light food when you come home late at night. And then also, like I said, making sure when you get up in the morning, you're making sure you're exercising, because that food that you just ate at night is just sitting right there. It sat there overnight and it just turned into fat. So you want to make sure you get up and go exercise every day. So at least you finding time to work off the food that you ate, because your lifestyle just calls for it. So sometimes you have to manage it according to your lifestyle.
Thank you. Let's take one more caller. Caller, your name and where you calling from.
Hey, Dennis, this is Jimmy Eastman. Can you hear me?
Yeah, Jimmy, you're live. Thanks for calling.
Very good show, very educational. Thank you, Abby. I have one question, and I always found this to be a mystery. People who do the gastric bypass, it's like miraculously they're cured of diabetes and other complications. Now, if it was only weight loss, well, you would say that as soon as you lose your weight, the diabetes will go away. But it seems to do much more than just weight loss. And so I'm asking Abby, why is that the gastric bypass is a cure-all for many of these people?
Thank you.
The gastric bypass is not a cure. It's part of a treatment plan to prevent, because most people who get it, they have high risk of getting diabetes and hypertension and other diseases that run in the family, or also based on the lifestyle. So, and most people who get the gastric bypass, they also get like almost 6 months to a year of psychological counseling with the dietitian and with all that, because there's a lot of complication that comes with it too. But at the same time, and if you don't do what you're supposed to do, because like I said, it makes your stomach so small to where you can't eat that much anymore. So when you're not taking that much, when your body is not taking all the unhealthy things you used to eat before and the large quantity of food that you used to eat before, yes, your body's going to go back to, your numbers are going to start going down, and your body's going to go back to where it needs to be. So based on it, so it's not a cure, but it's a major part in making sure that I don't have control now. I don't have control over what I eat, but I have a high risk of getting all these things, and my numbers are looking bad. So if I can control it in a way where I can control the amount of food that I eat, yes, that will help me stay off all these other complications that come along with diabetes, or also go into diabetic functioning. So yes, like I said, once again, it's not a cure, but it's part of that. It's part of a major part of the treatment plan.
Thank you. We're almost out of time. Few questions here quickly. Tony Chia Harris is in Ghana. Say, I'm enjoying your show in Accra, Ghana. Please, says Abby, I went to the hospital a few days ago and my BP was 144/98. Can you say something about that too? Keep that. Let me bring in more.
The numbers high.
Yeah, okay, go ahead. Respond to that.
You said 144/92?
Over 98.
98. Okay. Those are high numbers. Those are high numbers, but based on your age, based on your background and other risk factors and all and other health issues, if those usually if a patient has that number and it may be a little younger, a little older, I may tell them to come back within a month, and if that number stays there over the second time around, and they have other and they start having symptoms like headaches, blur vision, because you don't never want blur vision and headaches and all that. That usually a bad sign. I may start you on medication because normal is 120 over 70, 120 was 70 to 80. So when you start going 20 point, your higher number, your upper number is high, 20 points higher than what normal is, and your lower number is higher too. So usually like 20 over 10, that's when we start going over, start thinking on putting you on medication. But we also, like I said, do the lifestyle change as well.
Thank you. Lasana Kamara talked about Guinness stout. I heard that too. He said, drink the black boy, Guinness. It'll help with diabetes.
I can't speak to that because I don't know. I hear that every time people also talk about bitter cola and impotence and all that. I don't know. There's maybe something maybe in it that helps that. I don't know. I haven't read any studies to speak to that.
More people with type 2 work at night because another person say, when he eats heavily at work, he's going to be tired. That's why he comes home before he eats heavy. It's 2 a.m. So those are some of the.
You can eat. Okay, take whatever you eat for dinner. You can take half of it to work, and then eat the other half when you come home. So that way, when you come home, you're not as hungry. Because when you come home and you're very hungry, you're gonna eat heavy. So,
Abby, what advice you have for people in Bannersville or Logantown that they may not have, and not everybody, some people who don't have, the food is not even there before talk about eat small portion or don't eat this, don't eat that. We used to have something called 001, no breakfast, no, no, lunch, and then just dinner. The chances so the issue with food is not a problem. Do you say that diabetes is not the issue, or they don't have those challenges that we have here?
Oh, they do, unfortunately, because they may be having something that's, that person just passed out. Oh, that person not acting themselves, or is something going on, and they used to be like this one. And unfortunately, there's not, like they said, primary care doctors, primary care providers over there that can say, well, let's do some blood work on you and see what's going on. And unfortunately for those people, they may be diabetic and they've never been diagnosed, and they go to the hospital. And if you passed out, they're going to start you on IV fluids, and based on IV fluids, and they can do emergency blood work and all that. So it's hard to like speak directly to Liberians, but what I would say is, eat a lot of fish, because back home, if you're eating meat and all that, that's when you were really wealthy. When you of means, put it that way. So eating fish. And if the young boys and young girls over there, make sure you continue playing sports, go to the soccer field, play. I know sometimes our parents just yell at us saying, come inside and do your housework. Before you're doing your housework, go outside and play, hang out with your friends, do a lot of activities and all. And for the older people, making sure you do the same thing, going out, just walk in the neighborhood, even if it's like 30 minutes a day. If you can do that, like the tires, you can push the tire, lift the tire, like heavy tire in the military, you can do that, climb trees, all of that. That keeps your body healthy, in action, in emotion, all, so that way you're not getting overweight. But there are times where you really everybody needs to have a routine blood testing done at least once a year. And unfortunately, that's not possible in Liberia. So hopefully those who are running for president now, those who are already in power, can you please, I know people saying you can get doctors to go there for 2 weeks and do this, but healthcare is ongoing. It's not something where you can just do for 2 weeks and then be done. Like, what if you had diabetes and you needed to get it under control? Those doctors not coming back for another year or so. Other people who go there, so you don't have the system in place to maintain the health of people. You're losing out on your population base, and it's not fair for people to be dying prematurely from things that can be managed and controlled. So that's where I get into my little political spiel saying these are the things that we talked about when we talk about comprehensive health care. That's comprehensive healthcare, not just saying I'm donating to this hospital, this and this, and you don't have the things to keep people healthy. Primary care is so important, especially in places like that. You need that. So eat healthy, eat a lot of fish, don't eat too much chicken, don't drink too much. I know a lot of Liberian youth, they drink a lot. I've been at parties where they do a lot of drinking, and that's not healthy. So don't drink a lot. Don't drink at all if you can help it. Especially if you can help it, don't do it, because sometimes you start it and next thing you know, you don't know if you have the alcoholic gene or not. So, and just know your family history, and just those things I talked about as symptoms and all. If you start having them, say, you know what, maybe I need to go see my doctor. And please, government of Liberia and other poor countries and all that, and poor countries or developing countries, please invest in your healthcare. Please, 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 please. It's so important. Please. You know, you have to care for your people. You know, a little clinic in every little village, in every little town, or a clinic for 2 villages here and there, that could keep people healthy. You know, people go there, you sit there. Even if what we're doing now, they say, okay, you know, I do telehealth every day. Or I talk to my patients, so you can still do the same thing. If patient can be in a village back home, in a place where you have internet, and you can have the computer screen right there. I'm looking at the patient. I'm doing this. I'm listening to the history. I'm taking the history, and I can diagnose them and then tell them go take this medication and things like that. So all those things you have to invest in, you know, working with your people over here, overseas, and all that. But hopefully somebody's listening, and hopefully people can do that. But at the same time, you have to make sure we get paid for it, because, you know, after all, you guys sitting there, you're getting paid. So that's all part of the healthcare. Put them funding there for people to get healthcare, comprehensive healthcare.
Great. Thank you so much, Abby. Anything about diabetes? I know books and books are written about diabetes, but anything that we didn't really stress that you want to mention, or if you want to do a summary as a closing?
Most important thing, want to make sure that you go to your family history. And even if you don't have any family history of diabetes, making sure you go into your doctor every year and getting your, as frequently as they want you to come, get your routine blood work and ask your doctor, what's my glucose level? And they're supposed to tell you anyways, because they're supposed to discuss your labs with you. What's my A1C? And once you hear what that A1C is, like I said, you'll be like, if they tell you these numbers, you're fine, you're normal, that's good. Doesn't give you green light to just go ahead and just live it up, especially if you have a family history of it. And when they tell you you're pre-diabetic, you know you're already in a yellow lane there. So it's like, okay, I need to start doing things. I'm getting older now. I can't be eating that much. I can't be sleeping out too late. I got to watch my stress level. I got to make sure I drink more fluid, mainly water or non-sugary beverages, non-alcoholic beverages. And once you get to diabetes, if they give you medicine, please, please, please. Like I said, most times you don't have symptoms, and don't say, oh, you know, nothing's going on, so I don't really have to. Make sure you're taking your medicine as prescribed every time. If you have any issues with it, call your doctor and make sure you tell your doctor so they can talk it over. If they tell you go see the eye doctor, you go ahead and see the eye doctor, because your eyes can be seeing fine, but there are certain things that the doctors have, the equipment that they do that you may not be able to see, that they can do, that your podiatrist, which is your foot doctor, your kidney doctor, if your blood pressure and everything's not under control, you probably have to follow the endocrinologist. And if there's any support groups out there, most of these things, especially for type 1 diabetes, you talk to your child, pediatrician, guidance counselor, school, and come up with a plan to make sure you keep them healthy, keep yourself healthy, and keep the whole family healthy. And diabetes is manageable. It's really manageable. You can delay the complications, major complications, as much as possible. A lot of people, like this lady said, she's been diagnosed forever and she's fine. People have diabetes for years and years and they're fine. But that's because they have changed their lifestyle and making sure that happens. So, if somebody says something wrong with your car, you're going to do everything to keep your car right so you can go to work, right? So your body is your temple, like the temple of the Holy Spirit, or the temple really religiously, excuse me, or just your body. You only have one body and you only have one life. So you want to make sure you take care of it as much as possible. And for men, like I said, you want to make sure that you keep your circulation and sensation so you'll be able to function as much as you want.
Thank you so much. Tomorrow, Wednesday, we'll have Roundtable Africa right here, focus on Labra at 1 p.m. Then on Thursday at 7, we're going to have Tough Talking Thursday. We're having Attorney Mariah Yakula. She's going to be our guest, and we're going to be discussing the ANC, Alice Cummings, and the CPP. On Friday, it will be the Literary Hour with Dr. K. Moses Nawe and Jackie Sayer. Always keep it here. Focus on Liberia, where we educate, we elevate, and promote all things Liberia. I want to thank you, Abby, for your time tonight. I want to thank our viewers who follow us and continue to follow us. Also, if you're not here, watch us on YouTube, Facebook, Twitter. Go ahead,
Join
Abby.
Abby Tyler's Healthy Living. I have a page, Abby Tyler's Healthy Living page. You can join on that. It says there, Abby Tyler's Healthy Living. There's a group. I'm more active on the page now because I can transfer things from the page easily to the group. So please join the family. I'm going to be on there every Tuesday as much as possible, or Friday, and I'll be talking hopefully next week. I won't be there next Tuesday because I have to go to a drugs seminar. So, but I would try to be there maybe Friday and do something on drug safety, medication safety. That's something very important that we talk to our patients about. So I'll be talking about that. So, and it's been a pleasure working along with you, Dennis, and the whole FOL crew. I really appreciate it. You guys have helped me so much. I'm forever grateful. So hopefully I can come back. Yeah, don't put me in the corner again, okay? Please, I want to come back more often.
Thank you so much. Thank you, and thank you for availing yourself to do this. Until then, on behalf of all of us here at Focus on Liberia, we close with our song that says, "We are all Liberians." Good night and God bless.
At Focus on Liberia, we discuss everything Liberia, from education to politics, arts and culture, entertainment, agriculture, history, religion, family, and technology. Focus.
We are Liberians. Liberia is our home. Liberian people. Liberia.